So welcome to Transform Gov, the Digital Government podcast with me, Maeve Neefsey. So in each episode, we're exploring the challenges, opportunities and success stories that's shaping the digital transformation that's happening in our public service. And we hear exciting insights from people who've been there, done that before, as well as really interesting success stories from those who are kind of leading the way or, in fact, are doing something that you really want to do yourselves. So Transform Gov is part of the Ireland eGovernment Awards, and it's brought to you in association with Accenture. So today we're joined by the winners of the Ireland eGovernment Awards category in AI for their AI in healthcare project. So we're going to hear all about that and, of course, learn from their experience. So this all came about really, this project, because of a new UK guideline introduced in 2023 to improve outcomes for stroke survivors, recommending that patients should receive 3 hours of therapy a day. So with limited budgets and resources, this is going to be, or was, a real challenge for rehabilitation units. But today's very resourceful guests, which is Emma Dunne, Occupational Therapist with the Royal Hospital in Belfast, and Dr. Dominic Holmes from eXrt Healthcare, they joined forces and have delivered astounding results. So first, I'm going to start off with Emma, and I'd say, but firstly, welcome, by the way. Welcome to Emma and also to Dominic to Transform Gov. So Emma, I'm going to start with you. So tell us about the impact of those guidelines on your team, yourself, and of course, your patients.
So as you said, the new guidelines have come into force, and we kind of always knew as therapists that the more rehab patients get, the better the outcome. And we know that we should be providing enriched environments. We know that we should be doing more. And so the 3 hours of motor therapy per day is only one of the requirements in terms of the guidelines. So they require also cognitive rehab, perceptual rehab, language rehab. So this is predominantly for our stroke patients. So obviously we have finite resources within the health service, and we need to think outside the box about how we're going to provide much more therapy to the patients. And we really welcomed these new recommendations because it is what is required. But obviously we don't have the resources or the time to spend 3 hours with each patient on the stroke unit. So we had to think about how we could make this better for our patients and how technology might be able to help us do that. Because otherwise we're never going to be able to meet those goals as they stand with what we're currently doing.
And before we get into, talking about the solution that you finally came up with, had you tried other technologies before to try and solve the problem?
I had previously sort of been quite keen on looking at technology, and I had applied for and got funding to look at virtual reality because I thought it would be a great adjunct to our treatments already. So I spent some time researching into it, was lucky enough to get funding to get some VR headsets and spend a lot of time researching what commercial games were already out there, which might be appropriate for our patients. And what I found was that actually in a lot of the gamification that's out there, there's nothing there that really was able to meet our patients' needs.
And would you have a particular interest in technology? I'm just interested in it from the point of view of jumping to the solution through VR. Did you have a particular interest in technology? Had you experienced bringing in technology in other areas of the health service before, or is it just your personality, Emma?
A bit of both. I mean, I do think I'd done a few wee projects prior to this, not very high tech, but just introducing at a very basic level, iPads, using apps and things like that with patients on the phone, and we're always on the lookout for new and innovative ways to kind of make therapy more exciting for our patients. And so you're always looking at what the evidence is out there for trying to create more motivating treatments for patients. So as occupational therapists, we're always on the lookout for new ways. And so it was just kind of a project that I kind of stumbled upon. and kind of then decided to research a wee bit more into it. And that's kind of how the journey started, really, for me.
And in terms of, you were saying that you tried a couple of, I suppose, let's call them off the shelf solutions for VR. What were the problems that you were encountering with them?
So a lot of them were that you needed to have really very good upper limb and hand function to be able to use the controllers. You needed to have really perfect hand and arm movement. So there was no way of me being able to grade the amount of activity and the amount of movement that you could use to play the games. So they were almost practically useless for me as a therapist, to be honest, because I need something that I can use with patients with a variety of deficits, from having no movement to having lots of movement.
So somebody, I'm just trying to think about what's happening. So for somebody who's got real difficulty with maybe their hands, their gripping ability, if you're asking them to engage with VR where they have to have that ability, it's not going to work for them, right?
It's not, because they can't use it to grip, and they can't use the fine motor skills to kind of use the buttons and twiddle what needs to be done on the actual handset either. So it's very difficult for them.
And which I presume most people who have strokes or have some challenges around things like their grip and their hands and their dexterity.
Absolutely. And lots of them don't have very minimal movement, and need a lot of support and facilitation by the OT to start off the movement as well. So
how did you come across Dominic then?
Yeah, so Dominic was involved, and he can tell you about that in the project. And basically through the Stroke Network and through just chatting about the project, I was able to do a wee bit of networking, and the digital and ecosystem lead on the board kind of said, I think I might know somebody who you could have a wee chat with about the problems that you're having. And basically we just sort of set up a meeting, and Dominic and I got chatting, and it kind of just went from there, from a simple meet up over Teams.
Okay, and just on a very kind of top level, how does VR improve a patient's outcome? What actually kind of results do you see?
So what we're looking to do, and what we've concentrated on, is really looking to get more repetitions of the movements within the treatment. So the more movement that you can do, and the more repetitions that you can do, the better. And it's kind of based on motor learning principles. And so what we're trying to do is get as many repetitions within an occupational therapy treatment session as possible. And so the average conventional OT session, we would get roughly between 35 and 75 repetitions. And basically with the outcome with the virtual reality was we were getting 200 to 500% increase in those amount of repetitions.
That's incredible. That's incredible. That's just great. And did you expect that at all?
I thought we would definitely see an improvement, but I don't think I was expecting that much of an improvement.
And why the increase in repetition? What was driving that?
I think there's lots of factors. So I think there was a lot of motivation. It's a new and exciting thing to do in treatment. And if we think about kind of gamification and rehabilitation, you get the opportunity to get rewards. There's competition. You can try and beat your score. You're getting a lot of visual feedback. And it's something very, very different and challenging and exciting. And the patients actually just loved it.
Well, I suppose if anyone's ever had to have any kind of physiotherapy and been given exercises to go home with, we can all identify with saying, oh, I'm really bored, even though we know it's really good for us and we have to do it. So I suppose just on the boredom level alone, you're eliminating that kind of tedium. And so it's such a clever idea to introduce the gamification within it. So, and you were saying about the patients, how did they react to it?
They absolutely loved it. I mean, we provisionally went and spoke to a lot of patients before introducing it, and asked what their opinion on virtual reality had been prior to kind of participating in the quality improvement project. And most people have been put on VR on Christmas Day by their grandchildren when they'd had a wee gin and tonic, and
Or two.
put on and put on a roller coaster and sent upside down and all sorts, and ended up feeling very sick and nauseous. So loads of people had kind of a lot of experience on it, and maybe not so positive. So this was really an eye opener for them, that they could do things that would improve their outcome. And I suppose for us as therapists, we kind of try to explain to patients that they need to train like a low-level athlete, and they need to practice and practice. And I use the David Beckham analogy all the time with them. You know, he didn't suddenly just be able to do a free kick from that corner. The way he did, he practiced for hours and hours and hours, and he repeated and he repeated and he repeated. And that's what we need. That's what stroke rehabilitation, there's a big focus on that.
And so the big message here is that people who are at home on Christmas Day should not be putting their older relatives into VR because you're going to make them sick.
Yeah.
But in reality, you found a solution for that problem by actually helping them through VR.
Yeah.
Is it difficult to get people kind of set up in the VR as patients?
No, it's all very simple. It's very mobile. We just take the headset and the iPad to the patient's bedside. We connect to the Wi-Fi. We basically just we have a setup for them already completed before we go to them, and then basically you just IVs or press on the app and it opens up, and away you go.
Fantastic. And the clinical team, how do they respond to the use of VR within occupational therapy? How do they feel about it?
Everybody's been very enthusiastic and taken it really on board. And I suppose everybody can see the benefits of it, the engagement. And I do believe as well that rehabilitation, should be fun. It's hard work, but and so you get a lot of people who, it can be quite noisy and a bit of yoo-hooing and yoo-heeing when they're trying to beat their score and things. So everybody's really on board with it.
And I think if there's a lot of cost savings. But before we get into that, I'm just going to take a very brief pause to thank our eXrt, who are our partner for supporting TransformGov. We'll be right back with more insights, so don't go anywhere.
Through the power of cloud, data and AI, eXrt is helping the public sector by blending human ingenuity, technology and a delivery-focused culture to turn their ambitions into action. Be ready for any challenge by adopting a continuous reinvention mindset to deliver human-centric services that adapt and grow with your needs. Contact the team at eXrt to find out more.
So how has the resource actually impact on the department? Because I'm thinking of, when I think of VR, I think of there's a lot of costs. It's difficult to roll out. How do you integrate that with your systems? I mean, tell me about what has been the impact on the department.
I mean, we developed sort of a protocol for the use of the VR so that if it can be lifted off the shelf and used by anybody. So you can just read about it, watch a little video, and then basically, hopefully, just any member of the team can go and use it. So there's not a lot of training required on it. It's not a cumbersome thing to bring to the bedside. It's a very mobile device to bring. So you can bring it, you can use it at the bedside. You can use it with the patient in bed. You can use it when the patient's out in the chair. You can bring them to the therapy gym and use it as well. So it's a very mobile device and very easily used. And that has been that's a key thing for us as therapists. It needs to be able to be easy to use and be able to use in a variety of settings. And that has been a big key thing for us.
I suppose I'm thinking about the number of patients. Can you increase the number of patients that you work with through not having to do it, I suppose, one-to-one, just you and the occupational therapist? Is that an impact?
Yes, absolutely. So one therapist can see two patients at the same time. Potentially, we've got the opportunity to see more. And that's what we're kind of looking to aim towards. But we can bring two headsets into a bay. We can bring two patients down to the gym, and one therapist can just set two patients up in the VR system and monitor that.
And do people tend to kind of self-manage a bit more in terms of their therapy if they have access to the VR headsets?
Yes, they can do. It depends obviously on the patient and the level of facilitation that's required. So if somebody has a very dense weakness in their upper limb, and we're facilitating that. We obviously need to be there. But if we're using it for fine motor tasks of the hand, we can just give it to them and they can just get on with it themselves.
Very good. So that you could, in fact, revolutionise just actually people be able to take care of themselves over time once you figure out how that can work.
Yeah, self-directed therapy is another big component of the new guidelines that have come in that we're trying to encourage. It's more therapy so they can get their conventional therapy alongside. So the more therapy they do, the better, basically. So if they can do their own self-directed therapy, brilliant.
And just, Emma, I know it's not easy necessarily to bring new technology into a new kind of healthcare system. And although this is a pilot, did you find, are there ways you learnt to make it more effective, to speed up the process, to help Dominic get in and his team get in more quickly? Anything you might want to share with other people who are going on a similar journey?
I mean, the whole thing has been a massive learning curve for me. I am not in any way sort of big technology-minded person. My nickname at home is Techno Girl because I need help to turn the TV on. So if I can kind of do something like this, then there's hope for everybody. But basically, I suppose the big learning for me is kind of getting in touch with all the colleagues within the Belfast Trust and finding out who the person is that can help you. And so IT, all your links there and getting them in and on board very quickly is absolutely key. They know that's their skill set. They know who you need to contact, what you need to do.
Well, you mentioned, for example, that there was somebody in there that's kind of trying to facilitate digital transformation really within the system. Is there a particular person whose role that is?
Yes, so that would be Sue Hun. And so she has been a great source of advice for us both about kind of what steps we need to do and where we could possibly go next. So I think it was Sue initially that got us both into contact with each other.
So Dominic, really good time to get you involved and to ask you a question about your innovation. How did it all come about? What kind of problem were you trying to solve when you came up with a solution?
I think it all really began after I'd finished my undergraduate degree in computer science and game development. Really, whenever I'd seen a PhD opportunity at Ulster University, I really liked the idea of the fact that I could use my skills as a games developer to help stroke patients improve and do the rehabilitation through the latest technology. And at that time, VR was coming out. It was really early back then. So we started working on these VR devices, building out these games, these very basic games to start with. And then introducing hand tracking to really customize the process. And I worked a lot with rehabilitation specialists during that PhD. And then from then we got really good results in our trials that we'd done with it, and we got the opportunity then to, or we were successful in getting a large European grant.
Who did you get the grant from?
It was from the Horizon 2020, the European Union.
Very good.
So that was a few million to start building out the product to a more commercial product. Really, the aim was to not let it sit on the shelf and let it start using it within hospitals and giving stroke patients the opportunity to do more rehabilitation. So we started building it, and we then done clinical trials across several NHS sites in Northern Ireland and in Italy as well, and we got really good results from that in terms of improving patients' quality of life by over 37%. And improving their independence as well. 65% of the patients, in fact, improved their independence. We got really good results, and that really spurred really me on. I was quite back then. Well, I still consider quite young. I don't feel it, but
you're probably only
young,
12, were you?
So I was young, and I thought, well, I don't really like my research to go out there further. So we started up this company with my co-founder, Professor Darrell Charles, and since then, for the last few years, we've been trying to build this product and get it in the hands of stroke patients and people like Emma to really provide those benefits to the patients so they can get out and be independent and back to their lives that they normally would have been without having a stroke. So that was really the motivation for us, and along with a part of a personal motivation for me was really a couple of my family members have had stroke, and a couple over COVID as well, including my father as well. So a good look, most of them recovered, and some of them are still recovering. So that's what drives me day in day out as well.
Through the power of cloud, data and AI, Accenture is helping the public sector by blending human ingenuity, technology and a delivery-focused culture to turn their ambitions into action. Be ready for any challenge by adopting a continuous reinvention mindset to deliver human-centric services that adapt and grow with your needs. Contact the team at Accenture to find out more.
That's fabulous, because like anything like this, there's usually some very personal reason behind it. So I was about to ask you, in fact, why stroke, so that makes perfect sense. So you could apply your own knowledge to a problem that you're very familiar with. So in terms of finding your pilots, because that can be a real stumbling block really for startups trying to enter the healthcare system. How did you make people aware, like you mentioned Italy there and obviously Emma and other people, how did you make people aware of what you were doing, and how did you convince them to trial it with you, with your team?
Yeah, that's always the challenging part as well, and I think really it was down to that networking part, and talking to the right people. Really, that was how we got there. And,
were you part of an accelerator, Dominic? Is that how you had the network to help you reach out to people?
Well, we were part of a couple of accelerators at that time. So I was on the Royal Academy of Engineering Fellowship, which was very helpful, and basically they help us start up setting up a business, but also how to find the right people and network with the right people that can get us those pilots as such, and the research done. And then we were also funded by Innovate UK as well on the iCure project, which was really all about how we can take me as a researcher and transform me into essentially a business with my product, with the product that we had. So it was all about market discovery. So go and find our customers and see if they want to use it, and if they want to use it, then start organizing those pilot trials. And we had done some early ones before we met Emma, but this one with Emma has really taken off, and we've really seen the benefits with that.
And in terms of, for both of you, so this question is both of you, what's next? You're doing a pilot, right? The pilot will have some outcomes which will be assessed. What are you hoping for next in terms of both the solution but also further integration within the health system?
For us now, we're doing another research trial now, and the real focus of that is how do we implement that into a care pathway that's, I suppose, been around for a long time. It's in the NHS, the way that they treat patients is how can we build our product to fit into that pathway so that we can give that benefit to the patient. So that's a real focus for us, because really ultimately we could give all the benefits of the day to the patient and get them recovered, but if there isn't a framework or isn't a protocol of fitting that into that care pathway, then rehabilitation therapists won't be able to use it properly.
Yeah.
And they won't adopt it quick enough. So that's really important for us, and a lot of the research out there doesn't really focus on that. And we think this is a really valuable point, a really valuable subject that we need to actually get a hold of and build out that protocol as such that Emma's been talking about.
And I suppose integrating with existing systems, because I know some of the stumbling blocks for a lot of technologies going into the healthcare system is if you're adding extra work that doesn't fit within the technology systems or the reporting systems, the administration systems, it's not going to work. Emma, would you have a view on that?
Yeah, well, from a therapist, from an OT point of view, we need something that works really well from the moment you come into hospital to the moment you go home, to the moment that you are even discharged from the community and can continue on your own rehab journey with reviews over 6 months, 12 months, whatever the case may be. So we're looking to what we need. That's what we need. As therapists, we need something that, that's invaluable to us, to be able to use that from the day after you've had your stroke right through. on your total journey for rehabilitation. So for us, this will be really key to look at, because if we can prove that this can do that, it's an invaluable resource for us as therapists and within the health service.
And what would be the dream? If you were designing the technology to suit your needs, and you could say what you really want next, what are you both thinking?
Like right now we're really focusing on the physical aspects of rehabilitation, but we know for stroke patients it's so much more complex. The mental health side of things impacts your rehabilitation, your cognitive ability impacts how you do your physical rehabilitation. So if we can help treat those as well with our solution, I think we could have a more of a solution that really, that's sort of nearly a one-stop shop for different treatments. Even the likes of speech and language, we're really interested in how we could incorporate that into our applications as well. And I think if we had that along with other partners coming in along with on top of our platform, I think you could make a real good case for having a system that suits a lot more complex needs in stroke patients.
Yes. And Emma, anything from you?
I kind of agree there just with what Dominic said. So, for us, our stroke patients have many deficits, and it would be great to be able to put them onto the VR and choose a program that's completely appropriate, whether it's a cognitive deficit, whether it's a perceptual deficit. And education is a big one as well. And if you're immersed in an educative environment, you take much more in than you do if I give you 17 leaflets. And even just to allow patients and actually relatives experience maybe what their relative is going through, and just increase their knowledge in and around stroke deficits, I think would be invaluable as well. But yeah, I think there's huge opportunity to create, somebody said, a one-stop shop covering all the possible deficits that you might have as a stroke patient. But I think particularly mental health is sometimes something that is missed a lot just through funding issues.
Yes, I suppose people get so focused on helping you with your physical, but of course the mental must be very difficult for somebody who's had a stroke, when they've suddenly lost their capacities, and that must impact on their ability to recover. And
there would be a lot of social isolation, within Ireland. So it's people who are maybe can't get out and about, and having a way of connecting with others, I think, would be very important.
Yes.
Having a meeting room that people can kind of virtually attend, things like that. I tend to get very carried away with myself.
I think you should, Emma. We need people to get carried away.
But that would be my dream, that especially for those patients who are very isolated, either in a rural location or because they can't get out and about, that they would have the same support network available to them, even though they can't get out and about, I suppose. So there's huge opportunities there, I think.
Well, look, I want to congratulate you because you're deserving winners of the AI category for the Ireland eGovernment Awards. I mean, it's a very exciting project, and also it's immediate in terms of the impacts on patients and the rate of, repetition of exercises and recovery. It's clear. So it's a no-brainer, guys. You're going to be huge. It's going to be everywhere across the health system. That's what I hope. And we're so sorry that this interview's come to an end because it's so interesting. But congratulations. We're going to get your award up to you. We'll make sure that happens and we want a photograph, please, or a video, please, that you can share with our community. But before we sign off, firstly, I just want to say thank you to both of you. Thank you for coming on to Transform Gov.
Thank you.
Thank you very much for having us.
Look, before I leave you off and let you all go off and have your lives, I have to thank very much our wonderful Transform Gov team here in the studio. So producer Conla Moran, our studio manager Peter Rice, our video editor Neil Horner, and sound engineer and videographer Lee Brennan. And finally, thank you to South Dublin Podcast Studios. Thank you.